Hello. Today I'm going to show you how to collect an oral, specifically the buccal or cheek, and nasal specimen for COVID PCR testing using a COVID self-test kit. First, depending on where you access the swab kit, the clinician, such as a pharmacist, may require you to complete a COVID test requisition with the client's information. It is important that the ordering clinician, such as a physician, a nurse in the extended class, or pharmacist, complete the information in the first section, or the specimen will not be tested. Before you swab, complete the required fields of the COVID test requisition with all of the client's contact information, including full name that matches the health card number if they have one, date of birth, current address including postal code, contact phone number, date of collection, and any other clinical information available, including symptoms, setting, vaccination status, exposure, and outbreak number if given. Ensure you have a full PCR testing kit, including a sterile swab, a capped specimen tube with transport medium, a bag with biohazard symbol on it, the appropriate PPE, including an N95 or medical mask if N95 mask is unavailable, eye protection, gown and gloves, garbage, and hand sanitizer. Clean your hands, open the package on a clean surface, and pick up the capped specimen tube. Check the expiry date on both the swab package and the specimen tube. Expired kits will not be tested. Ensure that the client's full name is written on the specimen tube and matches the name on the COVID test requisition. Specimen tubes must be labeled with full name and one other client identifier, either date of birth or health card number. Date of collection should also be written on the tube. You can also use a label sticker with this information and place on the tube, not on the cap. Before entering the client's room or before going within 2 meters of the client, clean your hands and put on full PPE, including gown, fitted and sealed checked N95 mask or medical mask if an N95 is not available, eye protection, and gloves. Check with the client that you have the right person and the information on the requisition and specimen tube is correct. Ensure you are able to see and reach the nose and mouth of the client. You can ask the client to sit or stand and explain the procedure and consent as required by your organization. Ask the client to open their mouth. Insert swab between the cheek and lower gums and rotate swab 3 times. Repeat on other side of the mouth. Ask the client to tilt head back and insert the same swab straight back, not up, into the nostril. Stop when you meet resistance, usually about 2.5 centimeters or 1 inch. Rotate the swab several times against the nasal wall and leave in place for several seconds to absorb nasal secretions. Using the same swab, repeat on the other nostril. While ensuring the swab does not come into contact with anything, carefully remove the cap of the specimen tube. Immediately place swab inside of specimen tube. Do not remove liquid in the container. Break the swab at the break point and close cap tightly to prevent leakage. If there is leakage, the specimen will not be tested. Place the specimen tube in the large part of the provided biohazard bag. You can also place a folded piece of paper towel in case of a leak. Then place the fully completed test requisition in the outer pocket of the bag. Remove gloves and gown, clean your hands. Remove or disinfect eye protection. Discard your mask, clean your hands, and put on a new one as per your organizational policy. The collected specimen can only be kept at room temperature for no more than 2 hours and should be picked up or dropped off to collection site to be sent to the lab as soon as possible. If unable to transport right away, it should be placed in a cooler with an ice pack or a dedicated specimen refrigerator that does not have food, drinks, or medications in it until it is picked up or dropped off at a collection site. If transporting the specimen to a collection site, ensure you are following local transportation guidelines for biohazardous material.